talk to me.
Information, news, and entertainment on demand.
WSRadio.com.
Welcome to OCC Balance, the weight loss show, with your host, Dr. Ariel Ortiz.
OCC Balance is about the beauty of keeping your body in balance. Now, there's beauty involved in balance, and of course today we're going to talk about beauty. Beauty meaning from a physical aspect. I want to talk to you about plastic surgery today. I know this is a frequent topic that's discussed on the radio, but I want to start by saying plastic surgery is definitely a discipline, a technique, a whole science that has evolved over the years. And the incredible aspect of it is that a lot of these new techniques are really not well known to the general public, because in fact, surgery is now just a small part of what we do in aesthetic intervention. So part of it can be plastic surgery, but some of it is aesthetic medicine, which requires no surgery at all. And this is interesting because, well, what you have is you have the ability to decide if you want a full-on intervention with surgery, anesthesia, to get, let me give you an example, some type of lift, either a face lift or a breast lift or an arm lift or a butt lift. Or you can use modern technology such as injectables or other types of energy transfer devices, which in turn stimulate the inner layers in your skin and under your skin, and ultimately reach the same effect that surgery would, but without the need of a formal incision. So when you look at the vast amount of techniques deriving from the advances in science, it's impressive, but at the same time it also can be somewhat confusing because, well, there's so many commercial names out there. If you look into the realm of the skin doctor, the dermatologist, well, they offer a lot of stuff. They offer things like lasers and deep heat and radio frequency, and then they use all these names like Vaser, Thermage, and all these. And apart from that, you've got all these techniques that are based in some type of energy application, radio frequency, light, etc., ultrasonic waves, or you have the basic injectables. And these injectables are none other than the ones that you already know. The commercial names are Botox and the fillers like Dermagen and some other newer, more advanced techniques, which we will be talking about today. Now, today I want to concentrate on just explaining that there are surgical techniques and non-surgical techniques for beautifying yourself. This especially goes for those that have experienced a massive amount of weight loss. And I'm not talking about really that massive. You can be down 30 pounds. Girls, ladies, I mean, you've seen it. When you lose a certain amount of weight, there's parts of your body that don't look the same. And you compound that with the years that are passing by, and what you're going to find is that these body parts aren't where they're supposed to be or where they were initially were. But there is hope. Let me be more specific. One of the biggest worries of any women, especially when they lose weight, depending on their size and volume of their breasts, is the actual breast itself. And as you lose weight, not only the volume, but the actual breast falls and lowers. And that's why the techniques such as breast lifts are so frequently done in centers like ours. Now, there are different techniques for breast lifts, and there are surgical and non-surgical. Let's talk about the surgical one, and in those cases where patients really actually have lost 30, 40, 50 pounds or more, with or without weight loss surgery, and they require some type of lift. How do you know you require some type of lift? Well, it's very typical that a woman will see themselves in front of a mirror and stand in front of a mirror, raise their arms all the way to the ceiling. And when you do that type of maneuver in front of a mirror, and then you place yourself sideways, you can see how the breast is reacting to those movements. And there's definitely as surgeons, a formula we use between the distance from the collarbones and from the midline. But ultimately, a woman knows. And when you know, that's when a patient will seek the counsel of a plastic surgeon to see what can be done. Now, breast lifts, like I said, are extremely frequent. We do them often. And sometimes, depending on the anatomy of the breast, sometimes you can get away without actually having to lift the breast. You just use an implant to lift and give volume. In other cases, the complex of the areola, which is the center, the nipple, and the areola, it's called a complex, is the skin above it has stretched so much that the whole complex has lost its positioning, and it's far below the typical positioning. In those cases, we have to do a reconstruction of the breast. And in those cases, we have to reposition that complex, that areola and the nipple, all the way to its original normal position, so that the anatomy of the actual breast looks normal and appealing, of course. And that can be done, obviously, with different types of techniques. Most of them, unfortunately, are going to require that scar that everybody's afraid of, that anchor scar. But there are new techniques that we use that minimize that scarring and that minimize the incisions themselves, and where the recovery is actually pretty straightforward and quick. Now, the results, and this I have said because, well, early on my during my residency program and then my training, I got to do thousands of procedures, breast lifts, breast augmentations, and breast reductions. And I can tell you for a fact that I've never seen a woman that's happier than the one that had too much and had a reduction, or the woman that had very little and got an augmentation. It is where, from a physical standpoint, a woman carries her womanhood. And this I heard from a very talented and, of course, respected breast surgeon specialist. When I asked, how can that be? And he simply said, when a woman is surprised or startled when she's completely unrobed and somebody enters the room unannounced, the first thing they do, girls, is cover their breasts. Womanhood is carried in the breasts, not below. So in fact, the breast, as treated by surgeons that are specialists, is not only something that we're doing medically. We find an artistic, a passionate approach to dealing with exactly the area where womanhood is carried, and of course the impact it has over the woman itself. And I can tell you, like I said, from my training, no happier than a woman that had the results she wanted, she desired, and she expected. That's why it's extremely important for you to do a consult if this is your case. If you're somebody looking at plastic reconstructive surgery, and in this topic, just talking about weight loss and the most affected bodily part, which is the breast, if it has affected, there is hope. And from a surgical standpoint, these surgeries are really advanced, pretty straightforward, and the results are spectacular. Because what happens is that, here's the principle: you have loose skin, but we can tailor that loose skin to the new body, to the new form of the breast, as we reduce it or we enhance it with an implant, and the results are incredible. So for further information, you can go to occbalance.com, where we have our plastic surgeon looking at this topic and other plastic surgery topics. And if you're interested in these topics, don't forget to join us on the following series of our podcasts at OCC Balance. We will be talking about plastic surgery and the new techniques, the new modern techniques offered today. In the meantime, I want to direct you back to that OCC Balance webpage where you will find more of these podcasts. I want to thank you again for listening. I'm Dr. Ortiz, your host, and this is OCC Balance, the Nutrition, Weight Loss, and Wellness and Plastic Surgery podcast. Till next time.